How many times is it possible to have a knee replacement? For people suffering from a failing knee replacement surgery, this is a question that many will face because they're thinking of getting a revision or a second knee replacement. Rates for having a second knee replacement differ depending on a variety of topics, including the type of knee surgery that you had, because there's different flavors of knee replacements. You can get a cemented versus a non-cemented, a partial versus a total. You can have robotic versus traditional, and there's so many other factors. Also, the location in which you have your knee replacement, where you live, the rates might differ in your city versus somewhere across the United States or somewhere else in the world. The skill level of the surgeon is another factor, and the specific hospital within a town or a city might have different rates compared to the one on the other side of town. Knee replacement revision rates reported by hospitals and institutions and generally across research are anywhere from 10% to 1%. That means that potentially 1 out of every 10 people are having a revision, or potentially 1 out of 100 people are having a revision. And needing a second revision, or a third knee replacement, in other words, is extremely rare. And truthfully, I've never heard of anybody doing this. I've heard secondhand stories of people doing this, but I've never specifically talked to a patient or somebody who's had a third knee replacement. Which, by the way, if you have, we'd love for you to share your information. So please comment below, give us a little bit of a story or a background about your third knee replacement that you've had on the same knee, so that others might learn from your situation. Now, a better question to ask, instead of how many times can I replace my knee joint, is have I fixed the muscle imbalance that's affecting the knee problem to begin with? A muscle imbalance happens when there's chronic compensation between muscles that causes increased pressures in the mechanical movements of the knee joint, and this can cause knee pain, and it can cause failure of a knee replacement. This is a problem that most surgeons and other healthcare professionals are just not trained to find, and especially not to treat correctly. But you can find help for fixing muscle imbalances right here on this channel. We've got a lot of videos that cover this topic, specifically for those that have had knee replacements or revisions to their knee replacements. Down in the description below this video, you'll find a playlist called Knee Replacement Pain Help, and you'll also find a link to a program that I've developed called the Failed Knee Replacement Recovery Program. That program is a comprehensive online program that walks you through all the steps to correct muscle imbalances in a knee replacement that's painful for you. If this information was helpful for you, please give us a thumbs up on this video, and also share this with somebody you think needs to see this. And don't forget to subscribe to our channel and turn on our notification bell so that you don't miss out on any of the helpful videos that we post each and every week. Thanks so much for watching. I'll see you in the next video. Bye-bye.